One is D. Very good. Vasculitis, stasis, turbulence. These are part of the Warshaw's triad, which tell us whether the thrombosis will happen or not. Correct, everyone? Am I right on this? Which tell us whether the thrombosis will happen or not. But protein C beta, it is what? It is a clotting agent or anti-clotting? It is anti-clotting agent. So if suppose anti-clotting agent increases, then there is going to be more bleeding and no thrombosis, right? So the correct answer or option should have been decreased protein C. So we have a good start. Question number 2, everyone. All are true about arterial thrombosis except all are true about arterial thrombosis. Again, a very important question, beta. Venous versus arterial. Venous versus arterial. What should be the answer? चलो हम पहले इसका थ्योरी पढ़ते हैं. Arterial is associated with active blood flow. Venous is associated with stasis. So it is stasis in the Warshaw's triad that refers to venous stasis. Correct? Next, the venous arterial grows in retrograde, whereas venous grows antegrade from the point of attachment. Line of Zahan is present in the arterial, absent in the venous. In the venous, there is incomplete lumen obstruction because the main problem is the stasis. In arterial beta, the main problem is atherosclerosis. So there is complete obliteration or obstruction of lumen. So beta, let us see. Arterial thrombosis has retrograde, true. Line of Zahan, true. White thrombus, true. And it has a complete lumen of the, इसमें तो incomplete होना चाहिए, sorry, incomplete होना चाहिए in the arterial, and complete lumen of obstruction should be in venous. So this is false. 2 is D answer, beta. 2 is D. Is this clear, everyone? Okay. Question number 3, which is the most common site of arterial embolization? Karo, ye karna hi hai. Karna hi hai. This question you just cannot miss. Very good. And beta, most common site of venous thrombosis is deep vein thrombosis. Again, of the veins which are below the knees. See, most common site of arterial embolization is heart, and the emboli that originates in the lower extremities. So if suppose heart would have been in this question, we would have marked heart. Right? So the order should have been heart, lower extremities, brain, intestine, and then last may be kidney. Right? So if the question would have been heart, हमें अगर question में option होता heart, we would have marked heart. Correct? Okay. Question number 4, chicken fat appearance is seen in First, let us do the questions, everyone, and then we will do the theory of hemodynamics together. Very good. The post-mortem clot. It is yellow and red kind of an appearance. Right? Everybody knows it. The yellow and red, the yellow portion represents the plasma. And the red cells, they form the clot, the red portion. So chicken fat appearance is the yellow and the red appearance that we see in the post-mortem clots. Very good. Very important question. Repeat question. All of you have done it. Question number 5, everyone. Common sense question. This is a common sense diet or common sense question. Each one of us knows that we should not eat sweets at much, right? So this, it's common sense, and so is this question. Think karo 5 ko and answer karo. Very good, Dr. Sweta. Very good. Very good, bete. Why? Because angioneurotic edema is non-pitting edema. Very important difference. Pitting edema we only see in CKD. So pitting edema हमें CKD में दिखता है, chronic heart failure में दिखता है, or we may see it in liver disorders. But beta, rest all of the conditions, angioneurotic edema हो गया, mixed edema हो गया, there we see non-pitting edema. So who will tell me? We have done it in the last class. Inflammation. Angioneurotic edema is due to deficiency of what? What protein? Deficiency of C1 inhibitor protein, complement regulatory protein. Remember the chart that I gave you? C1 protein, C1 complementary protein. Chart याद है सबको? Okay. Hypersensitivity angiitis is seen in? Hypersensitivity angiitis is seen in? ट्राई करते हैं. एंजाइटिस माने क्या? ट्राई करना है. ये क्वेश्चन ट्राई क्वेश्चन है, छोड़ना नहीं है इसको. एसएलई एंजाइटिस, हाइपर सेंसिटिविटी एंजाइटिस है. No, beta, it is henoch-Schöllen purpura. What is HSP? You must know. HSP is angiitis, right? It is also known as cutaneous small vessel vasculitis. Correct. So, beta, hypersensitivity angiitis is another name for henoch-Schöllen purpura. Berger's disease we will do when we do kidney and when we do the other arterial diseases. ठीक है, ये इतना पता होना चाहिए. Hypersensitivity angiitis. Now let us quickly revise our hemodynamics. ठीक है, hemodynamics and neoplasia. Okay, so let us revise. First of all, what is the difference between exudate and transudate? You only tell me. It will be like a small quiz. If you know it, that's good. If you don't know it, you will tell me. Right? Please tell me which out of the two is protein rich. Which out of the two is protein rich? Very good. Protein rich. Can you tell me? TB is an example of? TB will be TB हो गया, malignancy हो गया. किसके example है? So exudate and transudate you have not studied, is it? Okay, so this is my first homework because I can teach you n number of times. N number of times I can teach you, but if you don't learn it together, right? If you don't learn it yourself, exudate and transudate together, then beta you're bound to make the mistake. So this is your first homework. Exudate and transudate you have to learn with example. Malignancy किसका है, protein किस में ज़्यादा है, which happens when there is imbalance around the vessel, which happens when the actual injury to the vessel happens, right? So no problem, tomorrow again I'll be taking malignancy and this. So I want this to be learned only by you, not by anybody else, right? I cannot tell you this and then wait and see whether you know it or not. Okay, next everyone, Warshaw's triad you all know. So in this one question I want to ask, stasis is a factor in the arteries or in the veins? Stasis is the factor in the arteries or in the brain or in the veins? Very good. Very good. Excellent everyone. ये तो सबको आता ही है. Next is difference between red infarct and white infarct. Okay, ये अभी हम कर चुके हैं, but we have done it in a different word. Red infarcts are arterial. White infarcts are venous. No, sorry, arterial occlusion in solid organs. Everybody knows the Warsaw triad. Should I teach it? बताते जाओ बेटा, जो जो आता है. We will save time, do more questions. Right? If you don't know Warshaw's triad, please tell me, I will explain it to you. Right? So if anybody finds any problem in the basic concepts, then आप मुझे just एक message करो कि मैम ये नहीं आता है. Right now you message, I will explain it. Otherwise, we will save time on simplest of issues like Warshaw's triad, where there is stasis, hypercoagulability, right? So ये नहीं explain करेंगे. But anywhere you are stuck, you please message. Arterial occlusion in loose tissue and venous occlusion. Okay, done. Done. Next, most common organs जो इसमें affected होते हैं, red infarct में lung and small intestine, whereas white infarcts occur in the solid organs. Solid माने heart, spleen, kidney. This has ill-defined margins. This has well-defined margins. In the red infarct, edema is usually present, whereas in the white infarct, edema is absent. These are additional points which we have done. Next, difference between arterial thrombus versus venous thrombus. Major cause, beta. See, these are all the MCQs. So you should know all of this, right? It's better if you make all these charts together so that, we can revise them whenever we want to. Right? For hemodynamics, beta, मुझे इतने questions नहीं मिले जितना मुझे theory I know I can teach you, and those theory points you can use in your MCQs. Hardly one question will come from hemodynamics, but यही charts में से आएगा. Arterial thrombus, venous thrombus. Arterial thrombus, please remember, major cause is endothelial injury or turbulence. Venous, we all know, stasis. This is arterial one, has active blood flow or increased blood flow भी हो सकता है, मतलब it's going, whereas this is sluggish. Arterial thrombus, coronary, cerebral and femoral arteries. So this happens in the superficial and deep leg veins. अभी हमने पढ़ा था लाइन्स ऑफ ज़ाहन, प्रेजेंट, एब्सेंट. क्या होता है बेटा? देयर इज अ पेल प्लेटलेट लेयर, राइट, विथ ऑल्टरनेटिंग डार्क रेड सेल लेयर, राइट, इन द आर्टीरियल. Whereas in the venous, the red cells are mixed relatively with the platelets, so ऐसा कोई alternating band नहीं आता है, right? Next, occlusion, which was the question. Arterial do incomplete lumen occlusion because the artery is big. The venous do complete because the veins are small in diameter. Complications, this can lead to ischemia. This can lead to embolism. Very important. Arterial thrombus से embolism less होता है, venous thrombus से embolism more होता है. Right? So all of these are the points. Agreed, everyone? Next, please note the various conditions or checkpoint which cause increase coagulability. See, these are all the independent questions that have come. है ना? कौन कौन कर सकता है? Number 1, homocystinuria. Now, what is the question that comes from this even in medicine? Which is the independent marker? Please note beta, ये hemodynamics note कर लो, so that when you are revising, you don't even have to refer to your pathology notes. You just refer to these charts and to this box. That's it, and your hemodynamics revision will be done. ठीक है? This is the independent marker for atherosclerosis. Recent question है बेटा. What has been the recent marker for atherosclerosis? Right, it's a very new question and it is homocystinuria. Many doctors are giving its test also right now. Right, next, anti-phospholipid antibody, which was present in Shilpa Shetty. Right, because of this, there were a lot of embolization, a lot of thrombus, and she suffered from miscarriage. DIC, obviously DIC leads to this. Essential thrombocythemia means when the platelets increase, they start to block and they start to form the thrombus. और इसमें important हो सकता है dysfibrinogenemia. And one more question is factor 5 Leydig. This is the most common inherited condition leading to hypercoagulability. Normally, we can degrade the factor 5 activated, right? But this factor 5 Leydig is not degraded. So what happens? Always there is coagulation happening and the thrombosis occurs. Right, all of you know what are Zahan layers, which I explained, alternating platelets and red cell layer. So beta, ये बहुत important questions है. You just cannot miss them because one question only will come from hemodynamics and that has to be spot on. It has to be spot on. Okay, next, post-mortem clot. You already said it has the chicken fat appearance. One more thing, any question bete, you find the word artificial valve, right? So that also is a condition for coagulation for thrombosis. Prosthetic valve, right? So always think if there is a prosthetic valve question, either the question is on infective endocarditis or it is going to be related to thrombosis. right? Next is pulmonary embolism. Most common cause is deep vein thrombosis, right? From the deep vein, pulmonary embolism is there. So, beta, what is going to be your question? There is a bedridden patient, long term or chronic, sudden dyspnea happened. Okay, two questions I'm going to give to you. One question, there is a lady, she was pregnant and she gave birth. Immediately she started having sudden dyspnea and she died. What is she suffering from? Do not answer. Question number 2, do not answer till you please hear it. Next, there is a pregnant lady. She gave birth to a small baby. Then after 4 days, she had sudden onset dyspnea. She died or she was saved because she was in the hospital, whatever the condition. What is the cause? Can you please tell me? Two questions, please tell me. Two different questions, same, etiology, pregnancy, childbirth, and mother death. बताओ फर्स्ट का क्या होना चाहिए? What should be A and what should be B? Yes, everyone. Very good. First is amniotic. Everyone, please note. Amniotic fluid embolism. Very good. Very good. Because that lady died during the childbirth only. ये एक क्यू पॉइंट है. The lady, yes, and because of 4 days में amniotic fluid has no role. Now it becomes pulmonary embolism. Last class also we discussed Ramu had road traffic accident, femur was fractured. Now he had sudden onset dyspnea. What is it? You all know it is fat embolism. Okay, next question. Ramu loves to dive. Ramu went to the sea to dive, right? And when he started coming up, he started having dyspnea. He had a rapid ascent, dyspnea. Now what is happening to him? Now it is the Casson's disease or diver's palsy. Right, bete? Correct? Okay. Next is DIC, disseminated intravascular coagulopathy. You must know in this first what happens. All the factors contribute to making of clots, right? Therefore, we check for the D dimer or we check for the fibrin disintegrating products, right? Because clotting is increased in this condition. The patient starts to develop blue color dots on the skin, right? Usually happens in the old age. It can also happen post birth, right? And clots ho jate hain. Clots say what happens? All the platelets, all the clotting factors start to decrease. Once these clots break down, we see the D dimer and FTP increase. And this is what we check for. Any disease, any viral disease, any like even corona, even any kind of pneumonia, any kind of septic shock can lead to DIC.